Hello there. For those who are new, my name is Aamiya Shetty and I am a member of the M.M.I.O, which is the Misunderstood Mental Illnesses Organization. This YouTube channel is dedicated to explaining certain misunderstood mental illnesses. Remember this as a warning though. I am not a licensed psychologist or professional. Please do not self-diagnose yourself or anyone else. If you feel like you have the symptoms listed in the future videos, please contact a professional at once. Once again, I am not a professional. I am just a student interested in spreading awareness and helping out. Bipolar disorders. In this episode, I will be talking about and answering these questions. What is bipolar disorder? What can cause bipolar disorder? What are the symptoms? What are the common misconceptions? What are the treatments available? How we can help a person with bipolar disorder? And I will also be talking about the interview I had with Miss Shrradha Sidhwani. What is bipolar disorder? There are actually three forms of bipolar disorders. So, to properly define bipolar disorders as a whole, one would have to define each form separately as well. The three forms are bipolar 1 disorder, bipolar 2 disorder, and cyclothymic disorder. Bipolar disorders are classified as mood disorders. Bipolar 1 disorder. Bipolar 1 disorder is the longer lasting and more devastating in terms of its effects on the patient. Bipolar 1 disorders have two types of episodes that can occur: depressive episodes and manic episodes. Unlike the other two forms of bipolar disorder, bipolar 1 disorder has episodes that could potentially last for around 5 days to maybe a week. This shows one that bipolar 1 disorder has the longer running episodes than the other two forms. In bipolar 1 disorder, the patient will experience the worst highs and the lowest of lows. They will have severe mood swings that could ultimately result in the patient being hospitalized. Bipolar 2 disorder. Bipolar 2 disorder is the less lengthy form of bipolar disorder. The effects and episodes only occur once. The strain and effects on the patient's mind are less. In this form, the patient will experience less severe versions of the depressive and hypomanic episodes. In bipolar 2 disorder, since the episodes are less severe, they are referred to as hypomanic rather than manic. Cyclothymic disorder. Cyclothymic disorder is the smallest and less severe form of bipolar disorder. When ordering the forms in which has the worst effects and which is the least severe form, cyclothymic disorder would be the least severe on the list of the three. In this form of bipolar disorder, the episodes are not anywhere near as severe as bipolar 1 or 2 disorder. The depressive episodes and hypomanic episodes have a less harsh effect on the mental health of the patient. Nevertheless, it will still have a negative effect on the patient. What can cause bipolar disorder? It is the same as disorders like OCD. Bipolar disorder is highly genetic and runs through the family. As I said before in the previous episode, many of these disorders can be passed down generation through generation. According to Mayo Clinic, when a person is diagnosed with bipolar disorder, doctors can see a physical change in the brain. The causes are not fully and properly defined. What are the symptoms of bipolar disorder? Once again, like OCD, the symptoms are not things like having or catching a cold. The symptoms can be seen through scans of the brain if the disorder is severe. The symptoms can also be seen through the patient's actions. The symptoms of bipolar disorder can define which form of bipolar disorder one can have. But the basic and most looked for symptoms are having a depressive episode, having a hypomanic episode, and having a manic episode. Based on the symptoms that the patients have, they can be separated and divided into three forms of bipolar disorders. The other symptoms that can be seen in a patient that has bipolar disorder are: one moment or week, the patient seems energetic and overly excited. During this period of time, the patient can become reckless and they would be more willing to participate in things that could be life-risking and slightly dangerous. Also, during this time, the patient will become overly confident and will say and do things they've never said and done before. This would be called the manic or hypomanic episode based on the severity of the patient's wild behavior. Then, after their few months of recklessness, the patient will suddenly fall into a dark episode for around a few months. In this time, they will avoid contact with people. They will keep to themselves and be sad and lonely. This is what would be called the depressive episode. This happens to nearly all forms of bipolar disorders. Sometimes the symptoms are so severe that the patient is required and needs to be taken into hospital care so that they can recover. Sometimes the recovery can take months after a harsh manic episode, and recovery from bipolar disorder itself can take years. Sometimes people never recover from bipolar disorder. What are the common misconceptions? Many believe that bipolar disorders are much like having two personalities, meaning many believe that there are two completely different people within one. This is the most common misconception. Many also believe that people with bipolar disorder change their personality every day and every minute of the day. This is also incorrect. Usually, the drastic mood changes happen every few months, 1 month or so being the patient's hypomanic manic episode, and the months following being their depressive episode. What are the treatments available? Like OCD and many other mental disorders, bipolar disorders can be suppressed through the use of therapy from a trained therapist. According to the NIMH, or also known as the National Institute of Mental Health, bipolar disorders can be treated with psychotherapy. Also, according to the NIMH, one of the other treatments is taking certain medication. People who live with a patient who has a form of bipolar disorder need to understand and know how to handle the patient's health. Although they will not be responsible for everything, it is the best if the patient is kept in an environment in which they can thrive and feel safe. If they are kept in a negative and unsupportive environment, it could reflect badly on the severity of their disorder. How can we help someone with bipolar disorder? If one does not have bipolar disorder or is not a therapist or a psychology student who has studied bipolar disorders in depth, it will be tough to understand what to do and what to say. But there are a few things we can do to help. When the patient is going through their manic episode, we can make sure they don't do anything reckless and stupid by talking them out of doing those things. We can keep them company at all times so they don't jeopardize themselves when they're overly hyper. The most important thing that we can do is keeping them company and being there for them during the depressive stage. During the depressive state, they can become sad and secluded. They could also have suicidal thoughts. If we are there for them during this time, we can ensure their safety and keep reminding them that everything will be okay. If the patient's manic and depressive disorders go out of hand, they will have to be put into hospital care. We or anyone else can take the patient to the hospital and ensure that they get the care necessary to help them feel safe. If we take these steps, we can make a person's life so much better. Although we cannot get rid of the disorder, we can still help them out. The next portion of this episode is dedicated to the interview that I conducted with Ms. Shrradha Sidhwani. In this interview, I will be asking her a range of questions. Her answers will be displayed soon. In this episode, I will be asking Ms. Sidhwani these questions. What is bipolar disorder? What can cause bipolar disorder? What are the symptoms? What treatments are available? What are the common misconceptions? And how we can help a person with bipolar disorder? What is bipolar disorder? Unlike disorders like depression, bipolar is when there is a state of mood elevation along with the depressive cycle. So, there are two states. One is when a person is feeling very high and happy, and when one says the mood elevation, it is a manic phase that a person can go through or a hypomanic phase. A manic phase is when a person engages in things like excessive shopping, excessive socializing, excessive drug use that could lead to substance abuse. The person barely sleeps and they overeat. These would be going through the hypomanic and manic states. One will see that the person is not normal in their state. One can see that they will walk faster and talk faster. They are more hyper in that sense. And then, after a few weeks or few months, one will be able to see that the person completely loses the activity levels and goes into a depressive cycle. So, there is a pattern that occurs and goes on, but sometimes these patterns fluctuate over weeks. Sometimes they fluctuate over months. And often patients do come in and report that, a few months have been good, where I worked excessively, I play excessively, I socialize. But a few months of the year, I am completely and totally down. And so one can see a bipolar trend. So, this is what bipolar disorder is. It is very much different from other disorders like depression because one can see elevated levels as well. What can cause bipolar disorder? Bipolar disorders are very, very genetically related. So, there have been a lot of genetic studies, like twin studies, which have said that high rates of bipolar exist from family inheritance. So, I think that, or any kind of excessive trauma could also shake a person into a bipolar fashion, but mostly it is very genetic. What are the symptoms? If the person is in the elevated state, there is a lack of sleep, so they will only sleep for 2 to 3 hours at night. A normal sleep would be 7 to 8 hours. Excessive things like excessive eating, excessive spending, it could also be like a gambling addiction, excessive talking, excessive working, and then when the person goes into the depressed state, all of the activity that they were partaking in excessively collapses and the person will display depressive symptoms. What treatments are available? So, bipolar disorder very distinctly requires long term treatment, unlike depression, which can be managed with a short term treatment. Bipolar disorders require a long term treatment management where one will have to keep regulating the medications. There are mood stabilizers that are given to bipolar patients, and these are long term. It will take 2 or 3 years for the patient to come out of their bipolar phase using these medications. But sometimes people are unable to come out of their bipolar phase and they will require years of medical management. Of course, at the time when the person is very hyper in their manic phase, hypomanic phase, or the mood elevation, they will not seek any therapy. But if the patient is in the depressive state, they might seek therapy during the depressive episodes. So that is when the CBT, cognitive behavioral therapy, RBT, DBT would work. But classically, when patients are in their manic phase, they do not tend to go for their treatment. What are the common misconceptions? Misconceptions of bipolar disorders would be the fact that people do not tend to take it seriously. Like OCD, they assume that the reason why they are acting that way is that it's part of their personality or they are just acting like that. When in reality, there might be a serious illness. And they assume that it's a way that they choose to act, not realizing that it is a chemical imbalance and a serious mental health issue. How can we help a person with bipolar disorder? Bipolar disorder requires long term management and early detection of bipolar symptoms that are very helpful for treatment, especially during the patient's hyper stage in which they don't seek therapy. They feel that they are able to control all aspects of their life because they become overly functional. And so, in short, that means that they don't accept the disease that they have. I think first it is very important for that person to understand that they are suffering from this condition and accept the fact that this sort of disorder requires this sort of treatment. So we need to help them understand. Thank you, Ms. Sidhwani, for your help and professional input.